and welcome back to today's Cambridge Community Conversation tonight, featuring key managers from the Dorchester County Health Department. The Cambridge Community Conversations are an ongoing project of the Cambridge Association of Neighborhoods, WHCP Radio, the Dorchester Chamber of Commerce, and the Dorchester Star. I'm Mike Starling here at WHCP, reminding you that you can submit your questions in chat, and we will get to as many as possible. The usual housekeeping note applies that we are socially distancing each other in separate studios here at WHCP. And tonight we're assisted by Angela Grove, who's the Public Information Officer for the Health Department, WHCP Senior Intern Julian Jackson, WHCP Director of Video Services Doug Schick. And now let me welcome back Dorchester's great Health Department leadership. Joining Health Officer Roger Harrell is Deputy Director Dr. Casey Scott and Vaccine Equity Officer Valerie Davis. So let's get started with introductory remarks from Roger, who will introduce Dr. Scott and Valerie Davis before we go to the questions that have been received so far. Roger?
Well, good evening, and thank you, Mike, for the introduction and coming to you from beautiful down Cambridge in the Cambridge Matter Studio A, which I've been here before. The opening remarks I will share are what we've learned and not learned, and remind our community that we learn something new about the COVID virus every day, as well as our vaccine. The last time we were here, we had the good news, and Dr. Scott was explaining our vaccines that were coming online, and that they would be effective. And tonight we'll be going deeper into that. We know a lot more today than we knew then. But the bottom line, at the end of the day, that certain things still apply. Social distancing, which we talked about way back when, good old hand washing, wearing a face covering when you're inside among crowded areas, the testing that we continue to do, the things that we learned in the contact tracing and having individuals get ahead of this. It's not only the vaccinations now, but we need to test, and the positives need to isolate, and their contacts need to be quarantined. So with that intro, we'll pass it over to Dr. Scott, who's the real genius when it comes to the medical parts of this. Dr. Scott.
I won't take all that credit, but thanks, Roger. And thank you, Mike and WHCP, for having us here yet again. We were joking when we came into the studio that I don't know how many times we've been here, but I don't know that we all thought we'd be here at this point in 2021. But here we are. And I think one of the things that I've taken away from this experience so far is just how incredibly important communication is with our community. And that goes both ways, us being a listening ear, providing information that you guys find important, and also making sure that it's accurate. And then being a listening ear on the other side, knowing that we're providing you with the most up-to-date, evidence-based, non-biased information that we can in an effort to help keep everyone safe. And with that, I will pass it on to Val Davis.
Thanks, Dr. Scott. Well, my name is Valerie Davis, of course, and I'm the Vaccine Equity Officer. And I have the beauty of the job of being up close and personal, having those one-on-one conversations with individual people at their homes, in their churches, and talking and working very closely to leadership in some of our more underserved communities. It's a lot of fun. You know, I call myself a streetwalker because, you know, at this stage of the pandemic, it takes, you know, one-on-one conversations at people's on the front doorstep. And it is an amazing time to see the change. You know, I didn't say it was easy. I just said it's an amazing time.
Okay, well, welcome to all of you. And let's see what's going to be our first question to get this kicked off. And we're going to take you out of the streets and into the studios. So Dorchester's had a really high positivity rate. Is this all due to the variant mostly and unvaccinated people? What seems to be the happening out there?
I'll take that one. It's a combination of factors. So for one, our less than ideal vaccination rate, it's not terrible, but I'd feel a lot more comfortable if we were pushing 75% of folks vaccinated, and we've got some of that data to share with you tonight. We also know that the predominant strain right now is the Delta variant. You've probably heard about this on the news. It's kind of all you hear about now. There have been multiple variants that have come out, as what normally happens with viruses. They mutate pretty quickly, especially when they have unprotected or unvaccinated hosts in which they can mutate. And this Delta variant in particular seems to be more contagious. It's spread more easily. And it's still kind of up for debate if it's causing a lot of more significant illness. We're still sort of monitoring that. And it's also human behavior. We're all tired of doing these things that Roger mentioned in the introduction. We're tired of distancing. We're tired of wearing masks. We're tired of not being able to travel and do those things that we so long to do. I think there's a little bit of, a lot of COVID fatigue. And I think all of that is contributing to our positivity rate at this point.
Okay. I see that there's a question here that's come in from the field, but let's take this one first. For the double vaccinated people, should they really be wearing masks indoors because they could be carriers? What's the best recommendation here? I bet that goes to Dr. Scott.
You're right. So by double vaccinated, I think what we mean is fully vaccinated. So there's currently 3 vaccines that are available for use. One is the Johnson & Johnson vaccine. That is a single dose vaccine, but you're considered fully immunized 2 weeks after that 1 dose. And then there are two dose vaccines. One is the Pfizer, which is now FDA approved, and the Moderna, which is the one that the health department has had really from the beginning. And those, to be considered fully immunized, you need 2 doses, either 3 or 4 weeks apart, depending on which one you get. So 2 weeks after your final dose, you're considered fully vaccinated. The CDC recently changed their guidance that suggested that fully vaccinated people should wear masks indoors. And that's really bringing up an important point, an epidemiologic point that I want to point out. There's something called vaccine efficacy, and there's another thing called vaccine effectiveness. So vaccine efficacy is how well a vaccine works in a very controlled setting, such as a clinical trial. And when that data first came out about Moderna and Pfizer and Johnson & Johnson, and we were seeing 94 and 95% efficacy rates, what we were looking at is how good are those vaccines at preventing hospitalization, severe illness, and death, in a very controlled clinical setting. And for the most part, they're still doing that to a great degree. But what happens is when we start to immunize millions of people around the world, now we get to see what's actually vaccine effectiveness. And that's real world settings. That's places where maybe the vaccine was left out 10 minutes longer than it should have been, or someone who's slightly immunocompromised gets the vaccine. And so it's a little bit, they don't have as much of an immune response to that. So yes, we are seeing some of this vaccine effectiveness, which is at a lower rate than the vaccine efficacy in the trials. And the goal is always that you want to create a drug or a vaccine that efficacy and effectiveness are similar. So the other thing is there's been some recent studies that have shown that among people who are vaccinated versus unvaccinated, they can actually carry the same amount of viral particles. We call that viral load. And so for the people who can't get vaccinated, or for the people who can't mount a good enough immune response, we call them immunocompromised. That's why we still think it's important for vaccinated people to wear masks, especially in indoor crowded places.
Indoor crowded places, but not necessarily. I mean, how do we characterize Walmart, for example?
I wear my mask at the grocery store again.
Okay.
I mean, I would not want to be the one, I work in a clinical setting where I'm seeing patients. And so I consider myself to be at high risk of being someone who might harbor the virus and then spread it to other people unknowingly. In Walmart, you're probably not going to be super close to any one person for any amount of time, right? The same contact rules still apply. Remember that 6 feet for 15 minutes. Mm-hmm. But it's one of those things where it's a precaution. It's a layered strategy. We talk a lot about layering our mitigation strategies to reduce our risk. Masking is one of them. Vaccination is one of them. Physical distancing is another. And so if we think about all of these layers as pieces of Swiss cheese, right? Like neither of those layers by themselves are 100% effective. We put them all together and we really, really limit our chances of spreading this disease.
Okay, that's actually a great explanation, I think, and makes a lot of sense. Now, will Cambridge still be hosting the Ironman event in 10 days? That's an awful lot of people coming into our city. I guess that one belongs to Roger.
Well, the answer is yes. The team Ironman and they are got a great plan. It's based upon what they did with Eagle Man back in June. And while our transmission numbers were not the same as June, they have all the checks and balances in their system and how they have it laid out. And it's just a great professional team to work with. They actually have signed a special coordinator that will be working with the racers that are coming in to put in place a certain number of things. There'll be masks worn in the places where they should be worn. They will have hand washing, sanitation, be following all the protocols. They'll be doing some screening of the individuals when they come in about the test questions that you would ask about in the last 2 weeks. Have you been at symptoms of headaches and nausea, and et cetera, to screen them out. I'm very confident this group and has been working with our team at the health department. Dr. Scott's been working closely with them, and believe that the plan we got today, Dr. Scott, solidifies what we expect of them to do, and we expect to have it go on. I think we're trying to begin to learn to live with the virus in the community, but make sure we can have events that are, while they may be our higher risks, that we minimize any spread during that event. So the answer is yes. We're very supportive, and we can't have a better partner than Angie and her team from Ironman and what they put together. Very detailed plan.
Yep. We know they're very professional and thorough about everything that they attend to. Let's talk about breakthrough infections. Among the vaccinated, there seem to be increasing at an alarming rate, question mark. I mean, we've heard some stuff like that in the news. What can you tell us about breakthrough infections locally? Dr. Scott?
I'm actually going to throw that one back to Roger because I think he's got our numbers locally. Yep.
Yeah, I'm going to give you some of the local numbers in case he can give you the state's perspective and how we might compare to the state. Actually, our first case of a breakthrough was fairly back in April. Since then, that time up till today, the data that we have 122 cases of the breakthroughs. It's broken down by, when you look at our numbers over the last since the first week of the 8 in August till now, it's run anywhere from 8% of those positive cases that we have up to 25%. The 25% is fairly similar to what the state is. If you take the numbers of the 122 and you take the numbers based upon how many folks we have fully vaccinated in Dorchester County, it's not even 1%. It's 0.0078, which is a very, very small number. The good news is that the vaccine is working the way it should in terms of preventing serious illnesses. Out of this group of 122, we've had 10 hospitalizations, and that's all we've had to date. We have 0 deaths. So any deaths that we've had since this have been people that are unvaccinated. We also track how many days since they were fully vaccinated to the time that they have tested positive, and the shortest time, 14 days, and it goes all the way up to 133 days. And so some of those folks early on in the process in January, early on and February, we don't have any breakthrough cases that we're aware of in that group at this point in time. The age range on that, 19 and under, we've had one person, one case. 20 to 29, we had 11. And they had, in those two groups, there were no hospitalizations. 30 to 30, there were 12 with one hospitalization, and that was with a J&J vaccine. The 40 to 29, we've had 20 cases, no hospitalizations. 50 to 59, there was 29 with one hospitalization, and that was Moderna. Age 60 to 69, there were 23 cases with 3 hospitalizations. They were all J&J. And 70 plus, which we have a great number in terms of cases, you'll address that later. People actually 65 plus, we have a high rate of vaccination. But in that, there were 3 cases. One was Moderna, one was Pfizer, and one was J&J. I think it was 3 for Pfizer. So, and the breakdown in the racial category is African Americans were 31 of the total cases. Caucasians were 60. So we're tracking it. We're tracking our numbers locally are fairly close to what the state's tracking. I might add in there that in terms of the 122, 70 of those cases had symptoms. The other 52 did not. So that's more than half that actually had symptoms. So Casey, that's the overview for what we have done locally. You have any state data you would like to share?
I do. One thing that Governor Hogan had a press conference today, and he commented, the quote was that 0.02% of fully vaxxed Marylanders have been hospitalized. And so that kind of matches with that low number that you're mentioning, Roger. The one thing that I will mention is there's a lot of different reasons why this is happening, right? So we talked one thing about efficacy versus effectiveness. These are in real world populations, real world situations. So we know it's going to be a little bit less effective in that situation than in a clinical trial. Number 2 is we started our very first vaccine clinic was at the end of December. And so that first cohort of people who we immunized at the health department were fully immunized at the end of January. And we're coming up on like 8 months or so of post-vaccine. And so what we've seen and what the data is showing us is that there is some waning immunity over time. So that's playing a factor as well. Thirdly, we now have this Delta variant, which we know spreads more easily, potentially causes some more severe symptoms, something we're still looking at. But, when these vaccines were developed and studied, Delta wasn't something we talked much about, right? But then the other thing I want to comment on is, we're talking about proportion of cases that are vaccinated, proportion of hospitalizations that are vaccinated. In January, that number would have been 0 because we had 0 people in the county fully vaccinated, right? That number is going to increase. That proportion is going to increase the more and more people fall into the category of being vaccinated. And if we had a population, if our county was 100% vaccinated, 100% of the cases would be among the vaccinated, right? That doesn't necessarily mean that the vaccines aren't working. It means that there's a lot of things going on. I still have full faith that these are really our best intervention at this point to stop this virus.
Okay, thank you for that. So, and I'm sorry if I missed this. Here's a question from the field from Sharon. Do people need another dose of Moderna after having 2 already?
I'll take that one. Thanks for your question, Sharon. So I think you're talking about booster shots. And so that's a hot topic right now. Currently, the only population that is recommended to receive a 3rd dose would be folks who are what we consider immunocompromised. And that is a very specific definition by the CDC, which I have here because I knew that question would come up. So that are people who are receiving active cancer treatment for tumors or cancers of the blood. If you've received an organ transplant and you're taking medicine that suppresses your immune system. If you have received a stem cell transplant within the last 2 years. If you have any sort of moderate or severe primary immunodeficiency, there are some very specific syndromes that if you have it, you would know. If you have advanced or untreated HIV infection, or if you're actively being treated with high-dose steroids or other drugs that suppress your immune response. So if you're unsure if you fit into any of those categories based on your chronic illnesses, it's a good idea to reach out to your primary care provider and see if you do in fact qualify for one of these immunocompromised conditions to receive a booster shot. For the general population, there's some data that's being reviewed right now at the FDA and CDC levels that is looking to see if it is useful, safe, and effective to get a third shot. So I am anticipating that some federal guidance will come out soon. One of the things that Governor Hogan mentioned today in the press conference is that the Maryland State Health Department did some independent research, and they looked at nursing home residents and their level of immunity 8 months out. And they felt that the levels of immunity were waning enough that now nursing home residents or residents of congregate living facilities also qualify for this booster shot. And that was breaking news, came out today. So I will say stay tuned. If you don't quite fit into that category of those conditions I mentioned, I'm anticipating booster shot information will come out in the next couple of weeks.
And am I correct that it sounds like there's not really an anticipated problem with getting sufficient number of doses for whatever the recommendation turns out to be?
No, we, in terms of our supply, you mean?
Yes.
We have supply right now to start a booster program. We have means of getting more doses if and when we need them.
Okay. So it's not like it was when it first rolled out.
Right. And if I could interject, Casey, we are.
Go ahead.
We are doing the immunocompromised folks right now, are we not?
We are.
We are. Yes. So.
Yeah. So we're doing booster shots right now for those who are immunocompromised. We ask that you've spoken with your doctor. You do not need to have a doctor's note or a prescription in order to get that. And that was actually also announced today. We had not required that, but it was announced today that you should not be asked to provide that if you want to get one. I do also want to point out that the health department is not the only place where you can get a vaccine. We were one of the first places where you could get vaccinated. We'd be happy to give you your vaccine again, but you do not have to get your first, second, or third shot with us. You do not have to get your second or third shot at the same place you got your first shot. There's a lot of vaccine providers in and around the area, and they're all very willing to help you out.
Great. Well, thanks for that. I think, yes. How high of a percentage do we actually have of the local population that has been vaccinated? And I guess that's a question of one shot or fully vaccinated.
So I have those numbers. We get a report that comes out daily that tells us what our vaccine numbers are and how we compare to other parts of the state. So it's broken down in a few different age brackets. So I'm going to start with our older folks, which is who we started vaccinating in those early days. That was who was first eligible. That's our 65 and up population. So we have 83.5% in that age group who have had one or more, at least one dose, and 79.8% who are fully vaccinated. I'm really happy with those numbers. That's a little bit lower than the state average, but it's still really good. Then we look at our 18 and up population. So that's actually the Moderna eligible population at this point. Moderna is only under its EUA for those 18 and up. So we have 65.7% who have had at least one dose and 59.8% who are fully vaccinated. Among our teenage population, so the Pfizer vaccine initially was under EUA approval for those 16 and up, but recently that was dropped down to age 12 and up based on some new data that they had studied. So in that population, 32.2% have had one or more vaccines and 25.1% are fully vaccinated. When we first looked at that data, I want to say it was early August, before we offered a few mobile clinics at our schools, that 12 to 17, one or more was like close to 17%. So we've seen a large increase in that age range, which is great. And then for 12 and up, that's when you hear the eligible population, right? Anybody who's 12 and up is eligible to receive a vaccine. So this is more of an overall type picture. 63% have had at least one dose and 57.1% are fully vaccinated. And that's current as of this morning.
Those numbers sound like they're actually pretty decent, but I guess folks told me that Dorchester was looking alarmingly high for some of the latest infection rates here in the last couple of weeks. I would have assumed, based on what we heard earlier, that we were approaching herd immunity with these kind of numbers, but that seems not to be the case.
So we got to really look at that fully immunized number. And so our eligible population is 57.1%. My goal would be to get that closer to 70 to 75%. That's not necessarily herd immunity. That's just my goal.
Okay.
But I want to also point out that's of those eligible. So everyone under age 12 is not eligible for a vaccine. And so when you look at total population that is vaccinated, it's much lower than that.
Got it. Okay. Thanks for that clarification. All right. Is there a reluctance among some African Americans skeptical of being injected with an unknown vaccine based on some historical treatment of blacks in medical experiments? I bet this one goes maybe to our vaccine equity officer, Valerie.
You're absolutely right. And I really appreciate that question. And I actually hear it, rather frequently. But in reality, I guess it's actually two groups of people we're actually talking about, two age groups, because the African Americans over the age of 65, the rate of vaccination is pretty close to that of Caucasians. So there's a high number of people, African Americans over the age of 65, our older people who might remember better, what happened with the Tuskegee study and all of that. But they really are, they've done really well. And I think it really boils down to where people are actually getting their information. Younger people, and when I say younger people, I'm talking about people under the age of 40, under the age of 50, they're getting a lot of their information from social media and are treating it as gospel and correct information. So I think that there's more of a reluctance with that age group as opposed to African Americans as a whole. And one of the things that I do is share with them is that my first training, once I was pegged as vaccine equity officer, my first training was with the descendants from the Tuskegee study. So, and that was very, very enlightening. And they've done commercials that actually support the vaccine. I share that with people. And that kind of, that really eases some of that. So with older people, it's not the reluctance, there's not a great deal of reluctance. They knew from experience what vaccines have done for us in the past with polio and other diseases that we've had. And vaccines, they saw it, they experienced it, and there just wasn't a great reluctance. It's generally, more of the problem is with where people are actually getting their information, social media. And that's why it takes, small groups or one-on-one and talking to leaders to help them to really understand what the accurate information really is.
Well, it sounds like maybe we need to do a Cambridge community conversation every week. No, we would wish that on you guys. Okay, let's talk about, is there a reluctance of the white community based on the belief that this is all just a hoax, or does this loop back to the same theme that you were just talking about, Valerie?
Well, I think in part because people believe what they actually read on social media, and that just becomes, part of their foundation for, their beliefs in, the vaccine. But what I have found also that's actually very encouraging is those, one-on-one conversations, or in small groups, really just kind of plucking away at, some of the things that really just doesn't seem to add up. And unfortunately, people are, they're seeing what the impact of COVID-19, those infections. And I think with some of that, where they're actually seeing a loved one or someone they know who's been negatively impacted by it, they're changing. It's gradual and it takes time. And, nobody's ever said that it would be quick, but, there's a plucking away at it. And I think it's largely where people are actually getting their information. You can find misinformation all over social media, quite frankly. So it's just kind of, dispelling some of that.
Well, the Dorchester County Health Department is a great website that we would encourage people to always check out. Is there a danger that the state and local governments might have to enact serious mask and occupancy limits again? And if so, how close to those triggers do you think we might be, Roger?
Well, I don't see that's in the offing at this point. As we move forward, we have some different levels right now that we do look at from Centers for Disease Control in terms of the green all the way up to and dealing with community transmission all the way up to red. And we're at a high rate of transmission. So that would trigger what happens is, as I said to some folks, almost put flags up in front of the health to the day's red. So today, when you go into a close setting with your friends, you go to the Rotary Club, you should wear face coverings today because we have a high rate of transmission, as Dr. Scott discussed earlier. We got to do common sense things within our businesses, try to keep our folks distance as much as possible. We need to protect our economy, plus we need to protect our public at the same time. And so we need to begin to learn to do the right thing, i.e. wear the face covering when you're in settings where your people try to maintain 6 to 3 foot distancing between each other. Wash your hands often. If you're not feeling well, don't go into work. If you don't go to school, and that's a whole hard sell we've had with individuals who we had early on with some of the industries where individuals would have a fever, and so they would take Tylenol to mask their fever. They do testing. So we're talking about human behavior, and if we all do the right thing and understand that there's appropriate time to wear your face coverings, to keep your social distancing, and wash your hands often, we'll be fine.
Well, it's funny, just studying our own behavior. We got so used to wearing the mask, you'd feel naked if you didn't have it. And then it was so liberating not to have to wear it. Now we got to go back into, let's be on the safe side. So here's a question from Amy. When will the vaccines be out of the experimental stage?
I'll take that one. So currently there's one vaccine that has now reached full FDA approval, and that's the Pfizer 2-dose mRNA vaccine. So that it is no longer under emergency use authorization. There may still be some ongoing trials. So I don't know if it means are they still studying people who have been vaccinated? They probably will be. But that one vaccine has reached full FDA approval. The other two vaccines, the Johnson & Johnson vaccine, that's the single dose, and the Moderna 2-dose mRNA vaccine, they've completed their clinical trials and are through that emergency use authorization phase. So they're no longer in that clinical trial sort of, we're figuring out if we can offer this to the public. It is fully out there and offered to the public. It just hasn't gone through full FDA approval yet. The reason that these were sped up was because we were in a pandemic and they felt like the data was favorable enough and safe enough and showed efficacy enough that we should go ahead and start using it to try to tamp down this pandemic. I do think that Moderna has applied for their full FDA status, and that's up to reviewing data at the FDA and the federal level. And I also know that Pfizer and Moderna are submitting data on younger age groups because Moderna would like to extend their emergency use authorization to those really as low as 5, but we don't really have any idea on when that data is going to be reviewed. And we're hearing today from the governor that it's still months away that we might have some approval for those younger age groups.
Okay. Tell us about the best guidance on scheduling booster shots for each of the types of vaccines made available here on the shore. You talked about it a little bit, but can you be more specific?
Well, I want to reiterate again, please don't schedule your booster shot until we receive more guidance from the federal government on that. So at this point, booster shots are for those who are immunocompromised only. But what I will say is there does not seem to be, there's not going to be sort of a mass vaccination center anymore. So if you were one of the people who went over to the Civic Center in Wycomico County and got your vaccine, don't look for that to reopen. I believe we're going to be relying on our local health departments, our local pharmacies, as well as our large chain pharmacies, the Walgreens, the Rite Aids, the Walmarts, the CVSs, as well as local doctors to provide vaccines. And I know that there was a ramp up on getting a lot of these other people on board to provide vaccines. That's who's providing vaccines currently in the community. But I will say supply changes often. So if you're interested in getting it from your personal physician, ask the question, do you have this vaccine? The current recommendation and what we think is going to come out as the official recommendation is that if you do get a booster shot, you would need to get the same shot that you got the last time. So I got Moderna. I would be eligible for a Moderna booster shot if that guidance comes out. So you might want to call ahead and see what supply they have. And like I said, it has changed over time. For instance, we now have Pfizer. We never had Pfizer until summer. So we have both Pfizer and Moderna. We offer both at our vaccine clinics on Tuesdays and Thursdays. But I know some of the local pharmacies used to have only Moderna. Now they only have Pfizer. So if you have an idea about where you'd like to go, if you trust your pharmacist, you trust your primary care provider, you want to go to a health department, just call ahead and see what they have in supply.
Sounds good. Okay, if someone you know is being tested due to possible exposure, should you yourself be masking in public or quarantining? What's the best guidance there on being safe while someone that you've been around is waiting on their test results?
So I'll take that one. So that guidance, the way that we would advise you would depend on two things. Number one, are you vaccinated? Number two, are you having symptoms? So if you are fully vaccinated, so that's 2 weeks after your final dose of your series, and you have an exposure to someone who is COVID positive, you do not have to quarantine unless you develop symptoms. We do, the CDC has come out to say they do recommend testing 3 to 5 days after that exposure and wearing a mask until you know your test results. But there is no requirement to quarantine. Now, if you're fully vaccinated and you're exposed to someone who has COVID and you start to develop symptoms, we would ask that you isolate yourself, get a test, contact your health department or your local, your primary care provider. But really that's down to two things, your vaccination status and if you're symptomatic or not.
Okay. All right. Thanks for that. That helps a lot. What's the biggest surprise? I mean, we've been on an 18-month roller coaster here in society. What's the biggest surprise that you as health professionals have learned during the last 18 months? Roger, do you want to start that topic off?
What we have learned is expect the unexpected when it comes to this virus. I think as we talked about earlier about the mutations and the Delta variant, which is out there now. Tomorrow it may be another one. There have been some other variants that they're looking at and to see where they are. So I think the biggest thing that I've learned, it really is expect the unexpected and make sure that our answers today may change tomorrow based upon the information that we have at hand. I think one of the things that's not a surprise to me is how well the team at the health department has weathered the storm. The 18 months or so, we've got some respite here and there, but I'm blessed to have a staff that has the energy. They're staying the course. They believe in what we're doing, and they believe in this community. So that's not a surprise. Maybe the resiliency there has been extraordinary. I think the partnerships didn't surprise me. in the community, but it's been an outgrowth, I think, though, of our staff and how well they do. So expect the unexpected tomorrow. It may change. What we tell you could change tomorrow based upon what we know about the virus. So, Dr. Scott, you may provide your words of wisdom.
I was just surprised at how polarizing this has become over time. I think, early on, we saw just a lot of unity, a lot of strong community support, a lot of hope. And I think, I'm kind of, maybe I'm a little bit more surprised that it took this long for us to get there, but that pandemic fatigue is really setting in. And I'm seeing it, our team is phenomenal, but we're tired. I don't think I really understood like how much, support it would take to be able to go to work every single day and know that when you contact trace someone, you might get hung up on, or you might get cussed out, or that there would be sort of this, there's just a lot of frustration around it. But I am hopeful that, we keep trudging on, and we keep, at this point last year, we would have been in virtual school and we would have said no to Ironman, and there would have been all of these things that we didn't feel like we could do. And I think this mitigation strategies, this layered approach, the ability that we can test people as frequently as we can, that you can get a vaccine really at any corner pharmacy or doctor's office that you walk into. We're giving people the choice in this matter of what do you want to do to stay safe, and how do you want to keep the community safe. And so that feels hopeful to me that we are going to turn the corner. But it kind of shocked me at how polarizing it has become.
It's been quite a slog. How about you, Valerie Davis?
Well, everything that Roger and Dr. Scott said, but also what has been so amazing, and not in the best way, is how entrenched people are with their beliefs and what they see on social media, and how it impacts their decisions, and just how in communities where it's the same social media platform, that one apartment after another, they're listening to the same stuff, and all of that misinformation, and how entrenched it was, and how quickly it happened, and how sustained it's been.
Well, hopefully, thanks to you guys being here, this little social media event will be an echo chamber for good. So let's take a look at our next question now. And it's coming. There we go. Did you anticipate that the pandemic would be this serious at the very beginning of it all? Did you think it's maybe it's not going to be so bad, we'll be out of the woods in 6 months or a year? Or did you feel like this could really be a long haul, and 18 months from now we'll be back to WHCP to talk about it all over again? Who'd like to answer that one?
I can start.
You start and I'll follow.
I finished my public health master's in May of 2019, and there's not like a crash course on how to deal with a pandemic in that, but you do hear about, it takes about 2 years to kind of get through a pandemic, and then the recovery phase is actually the longest. We're sort of heading towards that phase right now, that recovery phase, but we're still very much in it. Back in March of 2020, when schools closed down and we were on stay-at-home orders, and it was just going to be a couple of weeks. I knew it was going to be more than just a couple of weeks then. And a lot of the behind the scenes at that point in the health department was spent not really knowing how to best help the community. We just didn't really have a lot of the things in place we do now. We didn't have a way to test people. There was no talk of a vaccine, right? There was, we weren't even very sure if masks were helpful or harmful at that point. That we just didn't have a lot of data on it. So to look back and to think how much we've learned in the past 18 months, it's incredible to me. I mean, I've never read more about one single condition in all of my years of being a doctor. Like, I've never had to learn this much about one thing. But we have there's a lot of data out there, and devouring that data and trying to decide what's non-biased and what would lead to clinical guidance that's the tricky part. So, I think I knew it would be longer than what I anticipated. I wasn't sure how long we would have these surges. And that's, I think, one of the things that has been a little bit disappointing. And I think that if we can improve our vaccination rate, then we can come out on the other end of that.
Roger?
Yeah. Well, I thought in my own mind, and looking at pandemics and thinking about the vaccine, I thought that might be the panacea for the pandemic, recognizing, yes, we could get into variants, but this vaccine does deal with the variants. But my experience and what I do about diseases that we had eradicated, one being smallpox, and years ago, what we have done with measles as a vaccine. And the biggest one, while polio is not eradicated in the world, we know, and Mike knows as a Rotarian, that throughout the world, we've been working with Rotary to eradicate polio. What surprised me was the human behavior that I really didn't anticipate. And I think Shelley Marshall summed it up in her comment. My white age group, 55-ish, keep saying they're scared of the side effects they heard of. They think the long-term side effects are more dangerous than the virus, and it's really sad. And I think that sums it up. I felt that the folks, once we had the vaccine, while we know the uptake on flu vaccine each year and flu shots is not all that great, the numbers are there, that once we had the vaccine, we'd have a shot at getting this under control. And that's the biggest thing that has troubled me throughout this. And I think about polio, and I'm of the era when the Salk vaccine was available, and parents, I guess because it was children and we didn't have the social media, parents made sure their kids got vaccinated because of the devastation of polio. And we don't set in our society with this particular disease. Mainly, as I was talking about what Shelley shared with us, and the same thing where I observed two gentlemen in Caucasian were being interviewed, both of them in the hospital, both of them having a rough time with the recovery of COVID, and one saying, well, as soon as I get out, I'll get the vaccine. The other one says, I don't touch it. I don't want anything to do with it. So we in public health deal with this, and Angela, I know, and what Valerie's talking about every day is changing behavior, and how do you change the behavior? So I was totally off base, and that's the thing that really, I guess, it did shock me in terms of probably when I go back to what that surprise factor that I didn't address earlier, Mike, and the pandemic itself. I thought the vaccine was going to be the panacea, and evidently it's not. We got a long ways to go yet, and the good public health techniques that we've been using will continue to work, but vaccines are here and they do work. So I encourage the community to please reconsider if you've been did not want to have a vaccine.
Valerie, what about you? Did you anticipate that this was going to be a long haul?
Well, in March of 2020, I started reading about past pandemics and learned that they're not very quick. But what has surprised me is the amount of patience that it's taking to bring some groups along and to help them to understand that this is really, the vaccine is for the not just for them, not good just for them, but for the greater good of all of us. And, I never thought that we'd have to work so hard to get people to understand that, this is, to just consider the better good, the greater good, what is best for all of us. I just thought that that would have just happened naturally, but it has not. It's taken a lot of work and conversations, and I'm hopeful that it will still happen.
All right, let's keep this conversation going about the best way forward. Is it still first, second, and third get that vaccination?
Can I take this one first?
Sure.
Yeah,
First, second, and third.
please.
First, second, and third, get the vaccination. And this just gives me the opportunity to talk about, of course, at the health department, we have our COVID vaccination clinics on Tuesdays and Thursdays, pretty much, from 9 to 3, basically nearly all day long. But we also bring the vaccine to the community. We're going to the corner of Cosby and Greenwood tomorrow for second doses. And I know that we have people registered for first doses. And we're going to churches. We're taking the vaccine to where people feel comfortable getting it, where they live or where they worship, where they play ball, wherever we need to take it, because we want people to be comfortable. And that has been one of the challenges, is making them feel comfortable with their decision to get vaccinated. And then maybe because I'm vaccine equity officer, I say the vaccine, the vaccine, the vaccine, because I really do believe that that is our way through this pandemic, in addition to, of course, all of the measures that Roger mentioned at the top of the hour.
Okay.
All right. If I could add to that, Mike, Val and I've had this conversation quite a few times, but we're almost at the point we need to go knocking door to door with a team. And if they're ready, we'll have somebody there to give them the vaccine immediately. And because you got to strike while the iron's hot. So it's like trying to get someone to treatment for substance abuse or whatever. You need to get that person when they're ready. So Val and I think that we're thinking about going door to door and having a campaign that way.
Yep.
Well, let's take just a second on that. Have you had pretty good success out with the mobile clinics? And I saw that you were at the Culture Festival a week or two ago. Did you have pretty good uptake there of additional vaccinations?
Well, we did not. And there was a very targeted crowd of people at the Culture Fest. And for some people, I mean, of course, there were many people who had already been vaccinated, but of course, there were, too many who had not been vaccinated. But I think the reluctance was that, some people, if they had an anti-vax stance, they wouldn't do it in front of a crowd of people. They wouldn't do it in a public forum. So we're really rethinking how we do that. We want to go to we want to take the vaccine to people, but we also have to make sure that it's at a venue where people will actually get vaccinated. So we did not, but I was happy that we were there. We made an appeal. We were there, at least people had the opportunity. And, we did have someone to get vaccinated. And we count them one by one with this group of people who are still deliberating. Everyone is a win for us. And of course, I wish that there were 50 people, but we really have to rethink how do we, bring the vaccine into huge crowds of people, because if people are on the fence, they wouldn't jump off of it in that forum.
But I would say even though our vaccination number wasn't high, because I worked that clinic, I talked to a lot of people about the vaccine and I answered a lot of questions. And I think that every time we go out into the community and we're present and we have a listening ear, and, when we're out at a mobile site, we're not like pressuring you to get vaccinated. We're here to answer your questions. What I think we need moving forward is to listen more and to answer questions. And, you know, my vaccine message is always going to be, I think you should get vaccinated, but I'm not going to make you get vaccinated. I want to answer the questions and concerns that you have and have a real conversation about it. You know, utilize my medical knowledge to the best that you can. And I think the more that we are out in the public and through all these mobile clinics, no one mobile clinic has had more than like our big mass clinic. But I think it's those little conversations that we have with people while they're waiting after their shot. You know, do you have any family members who are hesitant? How can we help? Those conversations go a long way. And I think that's a lot of what Val does, is she has a lot of these little conversations and brings us to have these little conversations. And then that does lead to more vaccination appointments.
And Dr. Scott, I just want you to know that with some of those conversations that you had, those people were at our last clinic and got vaccinated. So, you know, you don't move a mountain in a day. It's little by little, and that's what we're working through.
And that was Ashley Foxwell. That's our immunization coordinator. Thank you, Ashley, for all you do to help get our clinics set up and organized. We appreciate you.
Yeah.
And she validated exactly what you said.
Yeah.
Let's talk about that
current
schedule. We're going to run out of time here, so let's push through the key information. What's that current schedule for testing and vaccinations?
So testing right now, we're doing it at the health department on a drive-through basis. You've probably seen the line get backed up on Monday mornings from 9 to 11. So that's our standard time. If you are in line during that 9 to 11 time frame, we will get you tested. Okay. However, because we've seen an increase in demand for testing, we do take people for testing by appointment other than on those Mondays. So we would ask that you call the health department. It's 410-228-3223 and say that you need an appointment to be tested if you can't come on Mondays from 9 to 11. Our vaccine clinics run also at the health department from 9 a.m. to 3 p.m. on Tuesdays and Thursdays. We are offering both Moderna and Pfizer vaccines basically during that time frame. You can call and make an appointment that would ensure that we could get you in at the specific time that you need. You can also walk up. We will get you registered on site. And then Val, I don't mean to put you on the spot, but do you have our upcoming mobile clinics handy?
Certainly, yes. Well, we're tomorrow on the corner of Cosby and Greenwood for second dose, but I know that we have people scheduled for first dose as well. And next Thursday, we're having the Holy Street Clinic. There's a street in town that has 4 churches in one block. And we're doing vaccines for those 4 churches and the surrounding community, which is on Phillip Street. So those are the 2. And then there's another one in Vienna. I don't have the date in my head, I'm sorry. But the next one, the third one is in Vienna at the ballpark.
Okay. Well, I think with the indulgence of our team here, perhaps we can go just a little bit longer and take a couple of more questions, because there were a couple here that I especially wanted to get to. And this is one: if someone is getting ready to travel and has the sniffles on the weekend before they're leaving, can they go and get an over-the-counter test? Are those reliable, and do they yield fast results?
So I will take this one. So this is hinting at the idea that now there's 2 sort of main tests that you can get that would tell you your COVID status. One is a PCR test. We call it a molecular test. It's the test that we do at the health department. It's the test that where if you're going to your doctor's office or an urgent care center, if they send out the lab, that's the lab that they're doing. That's kind of what we consider the gold standard, the best, most sensitive, meaning it's most likely to find COVID if you're COVID positive, and specific, meaning if you test positive, it's because you have COVID and not because you have the cold. So that would be the best test. And for someone who has 0 symptoms, someone who might be getting tested to test out of quarantine early, that's the test you need. Okay. There is a rapid version of that test. It's called a rapid PCR. There are not many places around providing them. There are some urgent care centers and some integrative health clinics that are offering them in and around the community. You might have to pay out of pocket for them, but rapid meaning you get test results in about 20 minutes. There is another type of rapid test that is also done at doctor's offices, urgent care centers, and it's actually also one you can buy yourself over the counter, and it's called a rapid antigen test. It's okay. It is best used for people who have symptoms. Okay. So in this scenario that you pose, someone has symptoms, they don't have a known exposure, they're not sure what's going on, they decide they're going to buy an over-the-counter test kit and take it. I think that that's actually the reason that those test kits are made. That's what they're for. This person has symptoms, they don't have a known exposure, they're pretty low risk for being COVID positive. It's not going to be the most accurate test you could get, but it's better than not testing at all. But for someone who wants to know if their kid is positive on the Monday before school, and the kid doesn't have any symptoms at all, I feel like that would be a false sense of relief to do that over-the-counter test, if that makes sense.
What if they had some symptoms? Is there much of a risk of a false negative that you actually get reassured when you shouldn't have been with those tests? I guess I'm asking about the basic reliability.
Those tests in general are less reliable than PCR tests. So the school's providing guidance at this point that if there are children who are under quarantine and are trying to get a test so they could come out of quarantine earlier, it's a recommendation that they do a PCR type test. That could either be a rapid PCR. Again, few places are offering them, but they are available, or a send out test. We're getting test results usually between 24 and 48 hours. So it's a pretty rapid turnaround, but I realize there's a frustration in not knowing that result right away.
Anything you want to add before we wrap it up on the Mu variant in particular?
No, Mike, I just wanted to add, and in case I may have more up-to-date information, one of the things we are looking at, I think the question, what have we learned from the rest of the world about what we should be doing? Most of the time what we do is based upon what the state and Centers for Disease Control, but we are still looking at getting our own rapid PCR equipment at the health department in the future so that we can be able to do the 20-minute test as well, because we think we want to provide that for our community. One last comment, and there are going to be other variants, but I want to address again the issue of those individuals who are not convinced that they should be vaccinated. We don't have the magic bullet, but in reading some of the comments, and there was one in particular regarding safe sex and HIV, and until AIDS came along, there were individuals that probably did not believe that even though you could get a sexually transmitted infection, they didn't believe, and that was the tipping point. We do not know what the tipping point is for an individual to make that decision to get vaccinated. And what this group and Valerie and Dr. Scott and our team, when they're out, want to continue to sell the product, may not close the sale today, but maybe tomorrow or the day after tomorrow, that sale will be closed. We don't want to give up on anyone. We're not going to force anyone. I would be a millionaire if I could figure out very quickly how to get people convinced that they should get a vaccine tonight, those that want to make the argument. So the team at the health department stands ready to help in any way we can. As you can see, I'm not the expert. I have my experts with me that keep me straight and make us all look good. And I want to thank the crew that's here tonight, plus my staff person, Alicia, Ashley, for chiming in as well, because you're the folks that make this happen, the boots on the ground. My job is to put in place the proper folks that can get the job done and support them any way I can. So great team at Dorchester County Health Department. It's not me, it's Casey, it's Valerie, it's Angela, and all my other staff. So thank you very much for this opportunity. Thank you, community, for participating tonight, for your comments and your questions. Keep them rolling. Facebook page is there. Angela keeps that up to date, and et cetera. So thank you again, and thanks to this community for all you're doing to keep us safe and having a productive economy.
All right. Thank you, Roger. And that does look like all the time we've got for today's Cambridge Community Conversation. Our deepest thanks to Roger Harrell, Dr. Casey Scott, Valerie Davis, Public Information Officer Angela Grove, your whole team. We're really quite fortunate here in Dorchester to have an accomplished, committed team of professionals like this helping guide us through something as horrendous as this pandemic. Big thanks also to Technical Director Julian Jackson, Engineer in Charge Doug Schutz. If you missed any of tonight's broadcast, you can tune in this Sunday at 1 p.m. We'll talk to you again the next time we get together for a Cambridge Community Conversation.
Yeah. Thank you, Mike.